The number of measles cases in the U.S. is surging in what has become the worst outbreak in 25 years. The CDC says 704 cases have been reported in 22 states this year, with 78 cases confirmed this past week. CBS News Chief Medical Correspondent Dr. Jon LaPook has more.
More than 70% of the 704 measles infections have occurred in people who are not vaccinated. The epicenter right now is in one state. Dr. Nancy Messonnier is with the CDC.
The outbreaks in New York City and New York State are the largest and longest outbreaks we've seen since measles has been eliminated.
The cases have occurred primarily in Orthodox Jewish communities, and the CDC is putting the blame squarely on anti-vaccination groups.
The outbreaks in New York are being fueled by myths and misinformation that is leading people to not get vaccinated. Under-vaccination in these communities is clearly what's driving these outbreaks.
One of the groups is called Peach, and they've been distributing anti-vaccine pamphlets in Jewish communities. In 2017, this illustration showed people in modern clothes. In 2018, the image depicts an Orthodox Jewish family.
These women have received information that terrifies them.
Blima Marcus is Orthodox Jewish and a nurse practitioner at Memorial Sloan Kettering. Do you think that the Orthodox Jewish community is being specifically targeted?
They're definitely being targeted. People are getting magazines that they've never asked for coming right into their door. They're getting robocalls warning them not to vaccinate.
For Marcus, the answer is non-judgmental education.
The anti-vaxxers have dug really deep, and women have a lot of good questions now, but we have good answers too.
And Dr. Jon LaPook joins me now. Jon, thanks so much for being with us. So what can be done about these pockets of people who choose not to vaccinate their children? Is there some sort of key to convincing them that, in fact, this is so critically important for them to do?
The million-zillion-dollar question, Elaine, and it's hard to know what to do because here's what doesn't work is trying to embarrass them, try to force them, try to shame them. None of that works. So I met a nurse tonight who is part of an effort to actually educate people in the Orthodox Hasidic Jewish community and to just very calmly go over their questions, every single one of them. And I met a similar person, a doctor in Oregon, who's trying to do the same thing. So I think we don't know what to do. We know that there's a big anti-vaccine movement there that's preying on people's ignorance, really. But sometimes the facts don't do it when you have emotion. You have the facts and evidence and science, and then you have emotion.
So meantime, you have this disease continuing to spread so quickly. How is the medical community dealing with these growing outbreaks, especially when you have measles spreading through the air so easily?
Yeah, well, you know, the Centers for Disease Control, the CDC, is ramping up its efforts. I think there's been the feeling on the part of a lot of public health people that we've been holding back on the anti-vaccine movement a little bit because the sense was, well, it kind of got a big boost in 1998 from this bogus article that came in The Lancet that supposedly showed a link in 12 children between the MMR vaccine and autism. That was totally discredited. It was the head person who was the lead author of that lost the medical license. But it took 12 years to do that. And in that time, what else was going on at that time? The internet was coming of age and social media and fake news and all that stuff. So there was a feeling, I did a few stories over the years about this, but there was a feeling, and I will confess I had it too, of not wanting to give oxygen to that anti-vaccine movement. I didn't want to really talk about it too much.
You want to draw more attention to it.
Because you don't want to draw more attention to it. But I think that was probably the wrong strategy because in the absence of any kind of public attention, it was growing and growing. And now, for example, in Texas, there had been 10,000 exemptions that people claimed for various reasons 10 years ago. That's now 50,000. And all sorts of people on all sorts of the political spectrum are saying, are weighing in on this for various reasons.
Because the misinformation seems to have taken hold, clearly.
You know, misinformation, what was that study? Fake news travels about 4 to 5 times faster than accurate news.
So let's talk about this concept of herd immunity. How is it that herd immunity can actually help prevent these outbreaks?
Well, herd immunity means that if enough people get vaccinated, and usually that number's around over 90%, that because it stops it from spreading, that it's actually protecting people who are not able to get vaccinated. And those people, Elaine, include babies under the age of 12 months, because usually you get the first MMR at 12 months, 12 to 15, you get a booster at 4 to 6 years. And also people who are immunocompromised and can't get it, people who have cancer, people who are very ill with various medical problems. And so you're protecting the community So, I mean, I was saying the other day that when a parent decides to roll the dice for their own child, they're not just rolling the dice for their own child, they're rolling the dice for other people, and you have to keep that in mind.
So, you know, the question is, who is most vulnerable here? When you look at populations, is it, you know, children under 5, adults over 70? Why is that they're more vulnerable?
Well, in general, kids under 5 and the elderly tend to be more vulnerable to lots of things, whether it's infection, any kind of infection. You know, we always have the pneumonia statistics, and who are the people who die? The very old, the infirmed. In this case, you've got these groups that are susceptible, and people are very blasé about it. They say, "Oh, measles. I mean, you know, people used to get measles all the time.
Sounds harmless."
No, not a problem, except that the mortality rate is 1 to 2 per 1,000. Now, that may seem like a little, but except if you have tons of people with the disease. And in the old days, before the 1963 vaccine, there were millions of people who got the vaccine, and there were tens of thousands of people who got hospitalized, hundreds of people who lost their lives, and about 1,000 people a year actually had inflammation of the brain and encephalitis, and that can lead to long-term effects too.
So let me ask you about how this disease progresses. So how long after exposure does a person actually become infectious?
Right. So they say the incubation period can be days to up to 21 days. And usually on an average it may be something around 10 days to 21 days, but it varies, which is why 21 days. That's why the incubation, that's when they said when they don't want to quarantine people, they said, well, if you've been exposed today, we got to wait 21 days because who knows, you could come down with it 21 days from now. But the thing that is most troubling, Elaine, is that you can be infectious even before you have the rash.
So you wouldn't know.
So, you know, you have a little bit of cold, you have a little bit of a sore throat, runny eyes, and you think you're perfectly fine. If I'm sitting here right now and I've got the measles and you are not vaccinated, you have about a 90% chance of picking it up from me. And here's the thing. I leave the room, the measles, because it's in droplets, it's aerosolized in the air, they can still infect you, even though I've been gone for a couple of hours. Highly infectious, and I want to get across to people the concept of R0. R0 means if you have one person, how many people are they going to affect on average? It's like 12 to 18 with measles. Ebola was 2. So it's one of the most contagious diseases out there. And this is just the measles. There are all these other diseases out there that vaccines have helped. I've heard it said that nothing other than clean water has been more important for public health than vaccines. And we used to have millions of people dying of smallpox, polio.
Right.
You know, read the book about polio and what was going on, the panic at the height of that kind of outbreak.
So critically important to get the accurate information out there. Dr. Jon LaPook, thanks so much for talking to us. Thank you.